Hey guys, Nurse D Porchae here. If you are new to this channel, here on this channel, we talk about all things nursing, health, and finances. And so today we're going to get into a Q&A with Bree Peppers. This nurse has trained over 11,000 in the field of remote learning. So if you are interested in learning all about that journey and just more in depth about some of the courses she offers, check out this video where we go into all of those topics. Okay, Marie, so let's go into some of the courses that you offer.
We have so many different courses now. It's been 6 years. Our original course was chronic care management. We still have that. We've added quite a bit to it. It's Medicare chronic care management. We have added some nurse navigation to it. Also, remote patient monitoring, which is also a Medicare program. We've added HEDIS, data abstraction to that, and also health coaching, a little bit of diabetes, motivational interviewing. So that
Is
course,
that all one course, or
yeah,
is
it's
that
one course.
wow? So
Yeah,
that's like a
the
lot of
HEDIS,
different positions within that one
oh,
course.
definitely. And RNs and
Yeah.
LPNs, nurse practitioners can take that.
Okay.
We do have some nurse practitioners that take our courses, but
Mhm.
mostly it's RNs and LPNs.
Okay.
That course is, we're hoping to get CEUs on that soon. We're applying for that. All our other
Okay.
courses do have continuing education credits. And we have the Utilization Review 101.
Okay.
Utilization Review is utilization management, utilization review, basically working behind the scenes, either for insurance companies or even in regards to the hospital, making sure
Mhm.
patients have the proper times that they can stay in the hospital when they need to
Mhm.
leave, working hand in hand with the insurance companies. That also is concurrent review, retrospective review,
Mhm.
pre-certifications. I mean, there's just so many aspects, not
Mhm.
just, hospital wise, but so many
Mhm.
aspects of the Utilization Review 101. That's for
Okay.
RNs, LPNs, nurse practitioners. It
Okay.
comes with 30 CE credits. It doesn't take too long. It used to take about 18
It's
hours.
loaded.
We've added so much to it. Now it takes about 25 to 30 hours because we're always adding to our programs to stay up to date with everything.
Yeah.
Let me back up. The chronic care manager course has HEDIS and remote patient monitoring, health coaching, a little bit of diabetes coaching in there. That
Okay.
course, if you do everything but HEDIS, it's about 55, 60 hours. If you add the HEDIS to it, that takes about 18 hours for HEDIS.
So this is one course. This one course is chronic care management. Is that what you called it? What
No.
was this course?
Well, the first course I was talking about, it's
Mm-hmm.
called chronic care management,
Mm-hmm.
remote patient monitoring. I think it says health coaching, but it actually has HEDIS data abstraction.
So that's
I know.
4 different remote nursing positions that you can
Yeah.
typically get hired
Yeah,
with that
with the
one
chronic
course.
care manager course, right? And
Mm-hmm.
then the next course I was going over was utilization review.
Okay.
That also can lead to many different positions. It's risk management, prior authorizations. Has
Mm-hmm.
sometimes the jobs have care management mixed with utilization review. The only
Mm-hmm.
reason why I started the utilization review course almost 3 years ago was because United Healthcare and Humana, some of the managers there,
Remember?
Molina, they were asking me, Marie, we love your nurses. We're hiring them, blah, blah, blah. They're great. And they give me
Mm-hmm.
feedback and they'd say, I wish they knew a little bit of utilization review. And I'm like, oh, okay. Well, I don't know anything about it and I don't have anyone to teach it, but I might in the
Mm-hmm.
future. So anyway, I ended
Because
up
a lot of
adding it.
times they'll hire you for both. Like when I was when I was first
Yes,
hired for case management in the hospital, they wanted me to do case management the first half of the day and then utilization review at the second half. So
right.
sometimes you're kind of
Mhm.
doing both. They go
Yes,
hand in
or
hand. Yeah.
sometimes it's just mixed in that
Mm-hmm.
you've got some utilization review, risk management duties, and you've got case management. It's just mixed into your job all the
Yeah.
time. So anyway, that's why we started it. And yes, LPNs can do it too. Then we have the telephone triage program. That is for RNs only. Yes, LPNs can do triage, telephonic
Mhm.
triage, remote triage. They do it quite often. But the program I have has a special software. They only allow RNs.
I'm currently in this course, and when I tell you loaded,
Mhm.
it's a lot of information. And so, right after this interview, I want you guys to check out this one here, where we're going to go into the independent telephone triage nursing, right?
Mhm.
And so we're going
Right.
to go into that in detail in this video. So make sure you guys check that out.
Then we have the diabetes course. It's diabetes health coaching and nutrition. The whole first section is on diabetes health coaching, motivational interviewing. It's taught for a person that is a nurse or as a health coach. So someone that has some health knowledge, but it's not, I mean, it's mostly for nurses, but I have allowed some people in that have some like other certifications, but 90% of the people that take it are nurses. My nurse that teaches this course also came to me to learn chronic care management, remote patient monitoring, and HEDIS. She worked a number of years at HEDIS for Optimum United Health. She got a job right away after taking my chronic care manager course. You know, she is an RN and remote patient monitoring, and she got a job with the company she works for now, which is a federal diabetes course that teaches people one-on-one how to reduce their A1C, get healthy, kind of get your diabetes under control. But basically, these people that she works with, it's federally funded, and it's like a grant. And these grants are always accepted because of the fact that, you know, there's so many diabetics. So she's on a grant, and it's been renewed every 2 years. She's been working almost 4 years from when she met me and took my course.
And it's a federally funded?
Yeah, it's the whole coaching program that's been federally funded, federally approved, and all part of the Diabetes Association. So it's all like top information. So we teach that with her. Then,
so with this course, will you complete it and then you have to go and take like a certified exam
no,
afterwards,
you
or?
can't, with diabetes certification, you can't be
Mhm.
certified unless you've worked in the field for 2 years
2 years,
with
okay.
another diabetes certified nurse overseeing you. You have to have X amount of people that you've health coached. And she didn't even have the certification when she got her job. A lot of people don't realize this, but probably 80% of the jobs, you don't have to have that diabetes certification. Not at all.
Mhm.
You know, they always say they prefer it. Some places do require it, but a lot of places, they want you to just work towards it because it takes 2 years to get the certification. And it's not like, oh, I'm working in med surg and I see a few diabetes patients. Well, not a
No.
few, but a lot of diabetes patients. No, that's not it. This is health coaching, diabetes training and care for patients that are diabetic. And you have to have 2 years of a good solid time of working with these people one-on-one. So usually people don't have the certification right away.
Right.
So she didn't have it. She eventually did get it. So we give you everything to help you get into the job, and then you can prepare over the next amount of years to be able to get your certification and take your test. So you might, like after a year, you might be able to like be certified, but you can't because you didn't have that 2 years of really focused and under someone that can oversee you.
Sounds like the CCM exam. Yeah.
Yeah. Well, right. I'm glad you brought that up. A lot of nurses say, well, do I need to be case manager certified? And like, if you look at United Healthcare, Cigna, Humana, so many of those jobs will say CCM preferred, or they'll say CCM required, or it say that they'll give you anywhere from 1 to 4 years to get your CCM.
Right.
Because you can't sit for that exam for the CCM certification if you haven't worked in case management.
Right.
So
I
a
got
lot of
hired
people,
without it. So just to let you guys know, I didn't have it. I still don't.
Right. Yeah. And some companies will require you to get it. Like you'll see United Healthcare will say you have to get it within 4 years or 2 years. But others, they don't care, as long as they have some CCM management people that are certified and leads or supervisors. They don't need everybody to have certified case manager CCM. So anyway, but the diabetes is nice. Because you could start your own little health coaching if you wanted to. I really didn't start that course though to teach people how to start their own health coaching business with diabetics. I'm teaching it because it's really strong on your resume when they see that you've taken this course for any kind of case management, care management, nurse navigator. Second part of the diabetes coach and nutrition, we have a whole second section, diabetes, nutrition coaching, and also food, teaching you just about healthy eating, working on
Okay.
exercise. We have a whole second part, and they don't have to do it. It's optional. So a lot of people take the diabetes course because they want the diabetes coaching. But the optional section is I have a whole other course underneath
Nutrition
that
is
for
very
them.
important. Yeah, for
Yeah, and I give
diabetes.
it to
You
them
should
because
really take that.
so I
Yeah.
give it to them and I say, look, you might not want to do the whole thing, the second part, the
Yeah.
nutrition and health coaching, but you're going to find so much value in there. So,
Value. Yeah.
take a look. Some people do the whole thing, some people just skip through it, but we really couldn't give people a diabetes program and health coaching
Without it.
without really giving them some great nutritional information. And this was
Hmm.
done by a certified health coach who had taken a year-long program from one of the top companies. So Cheyenne actually wrote out a lot of the program for us. And then Roseanne actually, who is the diabetes nurse, who works 4 years now in diabetes one-to-one health coaching, she did a lot of the lessons and the videos. And so those two did the course. I helped. I did a lot with the motivational interviewing, active listening, really teaching nurses how to coach people, because sometimes they think they know how, but they really don't. They don't know all the really good tips and tricks that I've learned. And so not that I'm perfect. I learn all the time, but I can
But it's
really help.
helpful.
I can
Hmm.
help open people's eyes up to things that they might not realize. So those are the courses
Yes.
we have.
Okay. Awesome. That's a good bunch. And I love that your course is so many different roles that you can do within that one course. If you take one course, you're not just looking at one role that you can go for.
Mhm.
You can go for several within
Oh
that one
yeah.
course. And so
But
it's
yep.
worth it.
But with
It's
the
very worth
chronic
it.
care manager, remote patient monitoring, health
Mm-hmm.
coaching, HEDIS,
It
that
is.
first course, there's like 50 different types of job titles you could apply
Mhm.
to. And then we help you with everything from learning what you need to learn, pre-training, so you can walk into these
Mhm.
jobs and sure, you're still going to have to learn. We're going to give you a lot of training, but start up with the new group and grasp everything very quickly. The employers are always saying how they love to hire our nurses because we know what we're doing right
Mhm.
away. And then we're absorbing the new material that they're offering us and training us. And we're catching on a lot quicker than someone who hasn't been subjected to some of this.
Amazing. It really is. It really is. Since I've
I
gotten the
know.
chance to kind of look at the courses and see what's in them, it's just amazing. I was just set back by all of the information that is
Mhm.
in these courses. You literally, because I get asked a lot through email from the last video that we did. Again, you can check it out here, where they'll ask, like, kind of what is the prerequisite to these courses? And it's like, you just need clinical knowledge because she's
Right.
literally going to take you through everything that you need for the role. I mean, as far
Yeah.
as
Mhm.
preparing your resume, right? Where to apply,
Mhm.
how to apply,
Mhm.
interview
How to
prep,
answer the questions when you're,
all of it.
interviewing. And then
Yes.
and then
Like
we
you
give
said,
them
computer knowledge,
the
that's a big
basics.
one.
Mhm.
Yeah, computer
Yeah.
basics.
Yeah,
So it
we
comes with a lot.
pinch myself because I'm like so lucky to get to meet so many people from all over. So the nurses have to be in the USA. I work with a lot of Filipino nurses and international nurses. I'm actually very involved with the Filipino Nurses Association. We have a lot of Filipino nurses here in the United States, and I tell
Hmm.
them they have to have 1 year working in the USA. Even if
Okay.
they've been an international nurse, say you've been a nurse 19 years in your other country,
Hmm.
most employers that I work with won't look at you until you've done 1 year in the USA, even if it's in a nursing
Okay.
home. They want
Hmm.
you to have the USA experience because our nursing is totally different than a
Different.
lot of these
Yeah.
other places.
Hmm.
And then for new nurses, I have a lot of new nurses that just graduate school and they're like, I want to work from home. I'm like, you need to
You
learn
need some
your
experience.
skills as a nurse. You need to learn
Yeah.
your clinical skills.
Hmm.
So I say you have to have at least 1 year clinical experience, but really, I mean, it's better if you have two or more. But
And if you
minimum
are
one
kind of
year.
like you don't know what role, you're a new nurse and you just don't know where to work to eventually lead to that space, go ahead and reach out to me. I'll put in the description where you can, and I'll work with you to help you kind of maneuver that place where you can decide which role you need to go into to eventually lead to working from
Mhm.
home. But just starting out as a
Right.
nurse, you definitely want that clinical experience. You're going to need it.
A video on dialysis nurse because because you were a dialysis tech and then a nurse for a while. You have a
Mm-hmm.
good video on that. And I get a lot of dialysis nurses that have been working 1 to 10 years, 15 years dialysis. And when they come to me and they take some of my courses, they get jobs pretty easily because a
Mm-hmm.
dialysis nurse does have a lot of clinical knowledge. And because our whole country's getting old, and sure, we don't want everyone to be on dialysis, but there's a lot of chronic kidney disease. So the dialysis nurse usually knows a lot about working with chronic conditions. And then of course, CHF and diabetes, because what goes along with dialysis, your
Right.
diabetes and your heart
Your
people.
heart.
So
Yep.
I find that some of the nurses that get into dialysis, they can transfer into remote nursing pretty easily with my help. Now,
Mm-hmm.
do you have to take my course to get a remote job? No, but a lot of people do because
It
we help
easier.
you.
It makes it easier.
Yeah,
I had
yeah.
not taken any of Marie's courses before I started in remote, but
But
it
you
took me a
heard
year.
about me. You
I,
heard
I
about
did hear
me.
about you, and that's where I learned about her was in the interview actually. But I didn't take any of the courses, and it took me a year of applying to get into a position.
Yeah.
It took me a while, and that is with even having conversations with managers in these roles, and having friends that work remotely, and being sent job listings and all
Hmm.
of the things. It still took me a year, and so I think that a lot of the things I did not know, I see that Marie puts in her courses. And so those things where you're kind of like, well, how do I prepare my resume? My resume was pretty horrible.
I fixed your resume for you.
Yes, you did.
You know, a lot of people go by what these people are saying, all these little gurus out in
Right.
Facebook or
The resume
Google land.
expert.
And it's like, when you're going for a remote job, it's totally different and you really have
Mhm.
to focus on certain things. And I have so many RNs that come to me and their whole resume is focused really on a job in the ER, ICU,
Mhm.
nursing home, whatever, long-term care,
Right.
but they're focused on bedside. The whole resume is focused on bedside. When they're hiring you to be a remote nurse, they don't really care about your bedside and all those
Mhm.
skills. Not at all. They
Mhm.
don't want to know. They know if you're an RN, most likely you know how to put an IV in. And
Right.
if you don't, there's an IV team at your hospital that will put them in. So they
Right.
don't want to know that you can put an IV in,
Right. So she
or
focuses on what you actually need to know to get into these
yeah.
positions.
I mean, we already
So,
know if you're an
mhm.
RN or an LPN, we already know what you're supposed to know as an
Right.
employer. Now, what
Mhm.
specialty were you in? Were you in hospice? If you had a certain specialty, then yes, that's good to know because that gives us more information. You're not just an RN with RN skills, but you have these specialty skills.
Right.
So
That'd be helpful. So we answered some of the questions that I have here that you and I get asked about your courses. The first one was which courses are for RNs versus which courses are for LPNs. And so as you guys heard Marie earlier, all of the courses are for both RN and LPN except the nursing triage course, right? And so
yes,
that is the
yeah,
only one. And it's because of the
right.
program that comes along in that course where you can
Mhm.
actually log into a system and get trained with the systems that's
Right.
used
And the
for the
system
health. Yeah, for the
right
triage.
is certified will not. And I even asked, like, could LPNs please? And they're like, no, you
Mhm.
can't. It's like against the rules. I'm like, okay, I don't want to lose
But
my
all of the other
opportunity.
courses, yeah, all of the other courses LPNs can take. And so what would you say the percentage? I know you mentioned it in the last video
Oh, about
of yeah,
LPNs.
our LPNs. Is it 40% you said?
So when it comes to remote jobs, of
Okay.
course, RNs have the big piece of the pie of what they can apply to.
Mhm.
LPNs is 30 to 40%.
Okay.
So 30 to 40% of the jobs that are out there are remote for LPNs. The rest are for RNs. Why do I say
Okay.
30 to 40%? Because it changes. Like I got a whole load of LPNs into Cigna. A lot of them have been there 1, 2, and 3 years. So when Cigna was very busy hiring LPNs, then I would say, well, it was like a 40% chance. But Cigna, my LPNs don't leave Cigna. I have so many
Okay.
of them. They don't leave Cigna. They
Nice.
don't, LPNs in so many companies, over 11,000 nurses are out there working because they took our courses, not because I got them a job. Okay. They have to
Mhm.
pass the course. They have to see the employer, pass that interview, win the employer over. I can't do any of that for
I
them.
like that
But
you said that, because you
yeah,
cannot just take a course and expect somebody to
like,
just
oh,
do the whole process for you.
yeah.
Like, you guys have to be involved and actually work the course, right? Learn. Like,
Right.
that is what
And
you're
do the
taking the
course.
course for.
I have
Yes.
some nurses that don't want to do the work in the course, and then they say, "Oh, Marie didn't get me a job." No, you didn't get yourself a job because you didn't finish the course. And Marie doesn't get you a job. Marie helps you to find those jobs, but I mean
Access.
a job for them. Yeah.
Right. It is access for you to learn how to get into these remote
Hmm.
positions yourself,
Right.
right? It's
And I
like
do have a
literally everything you need to learn to get into
yeah.
these courses. So,
I have a lot of private referrals. So I
mhm.
have many employers that will come to me. Right now, summer's slow. So I tell my nurses by June 15th to like September 5th, it gets really slow. You will see jobs for Cigna, United Healthcare, Blue Cross, all the
Mhm.
different companies, Aetna. But the jobs that you see are like much, much less in the summer because you've got the recruiter people on vacation. You've got
Okay.
management supervisors. So they're not putting up as many jobs because
Mhm.
that means that you need people to interview those people. And then usually there's 2 interviews, sometimes 3. Tell the nurses that in the summer, there's less jobs to apply to. And come September 15th through right before Christmas, it'll be crazy busy. That's the busiest hiring season, especially for remote nurses. Then it'll slow down for about 3 weeks after Christmas, and then it'll get crazy again, right up until the first week of May. And then somewhere around then it'll start to slow down again.
So now's
So
the time to get the course,
yeah.
get in, get the training, so that when it's busy
Yeah.
season.
I have a team of 10 that are on my payroll that assist me, some LPNs, mostly RNs, and they're great. They're wonderful. And we really do try to help people, but they've got to
Mhm.
help themselves. We're not going to hold their hand. We're not going to
Mhm.
baby them because an employer does not want someone that's going to be working for them from home who's going to
Yes.
have to be babied. And I
They don't
tell
have
the
time
nurses
for it.
that.
They really
No,
don't.
that
Yeah.
one of the things I say to nurses is, one of the things like you guys take my courses, we get you prepared for everything, not
Hmm.
just what to tell the employers, but we get you prepared so you know how to work from home, how you can be ready to do that, how to set everything up, how to pace yourself. So we give you all that. A lot of people that haven't taken our courses and they get jobs, so they have to now learn with everyone else because they get their new employee training. They
Hmm.
have to grasp what they're getting, and then they have to perform. And I tell a lot of nurses that, 90 days, they're fired or they didn't make it the 90 days. And I'm not trying to scare
Hmm.
people, but it
No,
happens
but
a lot.
it's real. Yeah.
Some of the
You have to
nurses,
know. I was
some of them take
surprised,
these jobs, they
actually.
don't know what they're doing,
Yeah. You hit the ground running.
Yeah,
Because they
yeah,
expect you to know certain things
right.
when you start in this role.
Right.
So,
And if you
yeah.
don't, they're willing to teach you a little bit, but you better grasp it quickly.
Yeah.
Or in 60 days, they're going to let you go. They don't always
Hmm.
say you're fired, but they'll say, I really don't think that you're able to grasp, blah, 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 the
Yep.
training or this and that. And
Seen it.
sometimes some companies don't give you the greatest training and, or maybe you didn't get the greatest preceptor, but most of the time that's not the case. Most of the time you get a decent preceptor, but that nurse did not
Mhm.
take my course. They had no idea they were getting into.
And it's a
No.
lot. It's a lot you have to learn. It's a lot of
Yeah.
systems because we have to use so many different systems to get the
Hmm.
information to actually, if you do like utilization
Right.
review to review things, you have to learn the system and then you
Hmm.
have to learn how to pull the information and then
Right.
do the review. So you have so
Right.
much time. You have to work quick. So,
Hmm.
and it's a
And that
lot.
a lot of nurses say to me, "Well, do you teach interquel and MCG?" We go over the basics in some of our videos, but your employer will, when they hire you, they'll teach you on MCG or interquel or whatever
Yep.
product they use, whatever
Hmm.
system they're using, and then usually within a year they will pay for you to get certified. So you need to actually be sponsored by an employer to get
Yes.
certified in interquel or MCG, and people
Hmm.
don't understand that. So when a company does say, "Oh, we want you to have interquel MCG," well, then that nurse probably worked somewhere else and had learned that product. A
Right.
lot of employers will take my nurses without any utilization review experience or any care management experience, even if the job says, like say Humana says they would like you to have, 1 year case management or 1 or 2 years utilization review. Many of those companies already work with my nurses. They already work with me, and they'll take my nurses who have my course. Maybe they've done 10 years of clinical nursing and they have no utilization review, no care management, and we get them in for the interview. Like I said, I can't guarantee any jobs. You have to land
So you
that
go
job.
a great bit of interqual and MCG so you
Yeah,
can get a overview what
we
it
give them an
is and how it
overview,
works.
yeah, and
Yeah.
I've got like pamphlets and things like that. But
There's no way to
honestly,
get the training otherwise. It's either on the job
yeah,
or like a course like this. That's the
yeah.
only way to get it.
Well, it
Yeah.
costs a lot of money, but you don't need it. You don't need
Well,
it.
I reached out to who is it that do the interqual? I reached out to that company directly to say,
Yeah,
hey, do
they
you, when I was looking for a
yeah,
remote
they
position, because
won't. They're
I
like,
kept seeing
no.
it,
Yep.
and they said, no, they
Yeah.
only offer it to like
Right.
employers. That's the only way.
Right. Because it costs
So,
like $20,000 per quarter
yeah,
or $50,000 for some of these companies to
it's a
be able
lot.
to get Interquel or MCG product.
Yeah,
So, I mean, we're not talking pennies here. So
right.
you have to be sponsored by your employer. So many of my nurses get in without really having any knowledge of Interquel or MCG. They train you.
Let me ask you this question, because this is a question that comes up a lot with remote roles, with everything
Mhm.
going on in the world. Do you think that remote nursing roles are currently or will be in the future affected by AI? Do you think that any of those
Oh,
roles will be
yeah, I get that.
eliminated?
I get
What do you
that.
think?
Everybody's afraid of AI.
Yeah.
And utilization review, probably some of the low level people, administration people, but the ones that are high school, or maybe they had an associate's degree and they're doing like the prior authorizations and some of the low level stuff. Some of
Mhm.
that will be turned into AI, but that's good because there was way too many people's hands in the pie. A lot of the nurses are still going to be used and be used big time, but a lot of the piddly stuff is going to be streamlined. Same with HEDIS. HEDIS is going to change, and it's been changing a little bit, where you won't need as many nurses to pull the data out because they're changing things up. But you're still going to need a lot of nurses. You're going to need the nurses to go through the charts to get the important stuff. AI cannot do the harder stuff, but
Okay.
AI can do the easy stuff. And AI
Mhm.
is messing up big time. So AI is only good as who feeds the information
Information,
and
right.
how it picks it up. So
Hmm.
there's going to be more jobs, I think, because of AI. And things are going to change
Hmm.
slightly, but no, we're going to need nurses. We're definitely going to need nurses. Population health and informatics is here. It's been around. That's going to grab more of the AI and have more nursing jobs also for us. Case management, care management, you need the nurse's touch in speaking to these people virtually. We're talking about virtual right now. I'm not really talking about
Hmm.
bedside stuff. But
Hmm.
no, AI is going to actually help because it's going to so many things, especially in utilization review, are so piddly and so many steps and waste. But
It is.
it's going to take a long time to get AI all in place. Also, Medicare is going to change very soon, 2030, getting away from the fee for service. And
Mm.
it's all going to be about the quality of service and what you're getting. And fee for service, meaning, okay, doctor's appointment, primary care, this amount of money. It's not going
Mhm.
to be like that anymore.
All right. So next question we have, how long are your courses accessible for? And do you have it where there's an additional fee if you want to have access for longer?
Mhm. Okay, all the courses except for two are 2 year access.
Okay.
And so the diabetes course and the telephone triage course, which are shorter courses, the RN telephone triage and then the diabetes health coaching, those are 1 year access. And then if the person wants to join again for another year, get access and all the additions that we add, plus I put jobs out all the time. It's $75 for another year access.
good. Okay.
For the chronic care manager, the patient monitoring HEDIS, that one, that runs 2 years. If they want another year access to the group and the course, it's $100 for another year after it runs out, after the 2 year mark. Utilization review, they get a 2 year access. After the 2 years, if it runs out and they still want to stay in the groups, they want the course information and all the stuff we keep adding. We add stuff every month. Then that's a $75 a year fee. I mean,
Okay.
it's cheap. It's cheap.
Okay.
Um,
So depending
so
on the course, between 1 to 2 years, and then depending on the course, $75 to $100 for additional access.
yeah, it's like
Okay.
nothing. Yep.
Yeah,
Yep.
that's very affordable. Okay, so next question, does the courses have CEs available? And you answered this earlier. Certain courses do. We're working on getting more of the courses.
Almost they
Yeah.
all have CEUs, and the last course little grouping that we're going to have CEUs soon, maybe sometime in September, is the chronic care manager, remote patient monitoring, health coaching, and HEDIS course. That is going to have CEUs. All the others have CEUs in place already.
Okay. Which is awesome, because then it's like you're
Yeah.
taking a course with this information that you actually need, and then you can use it to renew your nursing license. So that's
And I
really
know
good.
some employers give the nurses money they pay for
Mm-hmm.
some of the CEUs, so that's
Yep.
really
So you may be
nice
able to get
too.
reimbursement. Yep. I love that.
I have
Okay, so
my nurses are thrilled because it was a long time before I finally even tried to get the CEUs. They're just so happy.
because it helps. It really does. Every 2 years, I'm like, oh my God, I need to get all my CEs in
Yeah.
order. And so it helps to have
And
that readily available.
I'll mention the only states that we can't give CEUs to is
Mhm.
Hawaii, Maryland, and New Jersey, because
Right.
they want their own
Mhm.
what is it about those states?
Well,
They,
each
they won't take
state
out a
have
state.
guidelines for their CEs, and so the ones that we know about are those states that you mentioned that require their own CEs. So they want it to be within the state.
Right. So they want
So,
someone to have taught within their nursing board in their state.
right.
So New Jersey was only going to take New
Mhm.
Jersey ones, right?
Right.
And
Hmm.
Maryland and Hawaii.
From
Well, I
their
could see
board trainers.
Hawaii is
Yeah.
always difficult, but I was very sad to see Maryland and New Jersey, the other two that won't accept the
I would have
CEUs.
thought California, but
Yeah,
yeah.
that was good. So anyway,
Yeah.
that's the only ones that I can't give you the CEUs because your states
Mhm.
won't take out of state CEUs.
Right. Yep. And then I get the question a lot, does one need to have hospital experience, in which we touched on a
No.
little bit earlier, in order to
Hmm.
work in remote nursing roles?
Right.
Hmm.
Uh, so RNs and LPNs, like, sure, if you have hospital experience, you are
Hmm.
going to be able to apply to many more jobs than someone that has only had maybe home health, where they go from one patient to the next, elderly
Hmm.
people at their home, or somebody that's in nursing home, assisted living, like hospice. So yeah, if you have med surge or any of the acute cares, any hospital
Hmm.
experience, even cardiac cath, endoscopy, you have more opportunities to apply to different jobs that I'll have in the course. And I'll put up the job and I'll say, okay, this one needs a LPN or RN. You need to have 2 years of clinical, or I might say you need to have 2 years of acute care experience. So the
Hmm.
nurses who have been nursing home or home health, that is not acute care. So that's when you can't apply to that certain job. But
Hmm.
I would say 30 to 40% of the jobs that I put up for our nurses, I tell them to apply to, do not
Hmm.
require a hospital experience. So 30 to 40%. So sure,
Okay.
60% might say they want 1 or 2 years acute care, and that's hospital. Or they might say
Hmm.
they want ICU, CCU, whatever. But
Hmm.
30 to 40%, no. And then
Hmm.
sometimes, this is really nice, like with United Healthcare, Humana, or Elevance Health, they'll say they want long-term care, they want acute rehabilitation, acute rehabilitation. They'll even
Hmm.
say sometimes they want a school nurse. And I'm like, wow.
Oh, wow.
And as for school nurses, a lot of school nurses do get jobs after taking our courses. I always
Yeah.
recommend that the school nurse take the VIP package bundle, which is chronic care management and those courses along with utilization review, and it'll give
Okay.
you a good background. If you're a school nurse and you only take utilization review, then it's much more difficult for you to get a job because you don't have any hospital experience. You've done like school nursing, which is great, but it's limited. So
Yeah.
the school nurses usually take the VIP, the bundle package, and then they might actually get a utilization review job being a school nurse because they also took my other courses to, kind of make them well-rounded so that they
Okay.
understand the adults, the chronic care management, the diabetes, the CHF, the
Mhm.
COPD, all those goodies.
Okay. Okay. So that will lead us into the last part of the interview. So I get a lot of questions. Hey, I've worked in this area. Which course should I take? So I'm going to just give you
That's,
a couple of,
yeah,
huh?
that's a hard one.
I'm gonna
Mhm.
just give you like this area of nursing, and you tell me which course would be appropriate for
Okay.
this particular nurse,
All
okay?
right. Mhm.
So we just talked about med surg nurse. So where would you say a med surg nurse? Which course would you recommend for them?
Med surg nurse could take any of the courses, RN or LPN, except like I said, the LPNs can't take the telephone triage. But med surg
Okay.
nurse, any of the courses, they could take the VIP bundle package. They could take utilization review on its own. They could take the chronic
Mhm.
care manager with the HEDIS on its own. A
Mhm.
lot of people take the VIP bundle package because there's a $450 savings when you buy that package
So it's
compared to if you bought the courses separately.
separately.
But yeah,
Mhm.
med surge, ER, ICU,
Mhm.
like I said, the endoscopy, the
So
PACU,
there's not one
OR.
particular course over another that's suggested. They can just decide which area
Those
of,
people in
yeah.
hospital and those they can take whatever they want. Now
Okay.
ask me about long-term care and nursing home. That's a different story. Okay.
Okay. So
So
let's say
okay.
that nurse.
So say you're an LPN, you've only done nursing home, which I've done also. It's hard work. So I don't mean only like I'm trying to insult you, but
Right, right,
you've
right.
only done nursing home, maybe a little
Mhm.
rehab, skilled nursing.
Mhm.
You can take all the courses, but do not take utilization review on its own. It's going to be very hard for me to help an LPN who only takes utilization review doesn't and only has nursing home experience. So like
Mhm.
if you're an LPN and you have doctor's office experience and you've done prior authorizations, you've done a lot of administration stuff, and you've cared for, patients, bringing them back to the rooms, then
Mhm.
you could take utilization review. But if you've been LPN only working in the nursing home, all right, you gotta take the chronic care manager, that course first, or take the VIP bundle. Don't take utilization review alone.
In
It's
this
going to be
one.
too
Okay.
hard for us to get you,
That's very
help you get an
helpful.
interview.
Yeah.
RNs that are
What
in
about like dialysis RNs? What would
oh
you
yeah,
recommend?
dialysis RNs can take anything, any of
Any of
my
them?
courses.
Okay.
Yep.
So
And
that
and
means you
our
guys, you can take utilization review, you can take the
yeah,
HEDIS, you can
all of
take the
them.
care management, you can take
Hmm.
any of these and you'll be able to get a position in
Yeah.
any of these
Hmm.
roles. And you mentioned school nurse earlier, that they will kind of need a well range of courses. So you may want to do
Yeah,
the
that's
VIP
why I
package.
tell the school nurses to do VIP.
Hmm.
Um,
What about correctional facility nurses?
Oh, I have a lot of them, and actually that's pretty good because they a lot of them work like there's a clinic, so
Hmm.
you can get stab wounds and
Hmm.
suturing and all kinds of goodies in there, and
Yep.
or all of a sudden post med surge where or post pre-op. So the prison nurses or the correctional nurses, they can take just about anything.
Okay.
But again, the LPNs, you're going to be much more well-rounded if you have that VIP course. Now,
Okay.
RNs that are in the nursing home and you've only done nursing home, you can still take any of my courses. It's not like the
Okay.
LPN where I say the LPN really, shouldn't take utilization review on its own if you've been in the nursing home and that's it.
Okay.
But RNs that have only been in the nursing home, you can take any of my
Hmm.
courses. Why?
Okay.
Because there's so many more jobs for RNs,
Okay.
you know.
Simple. Okay.
Yeah.
What about, let's think of maybe oncology nurses?
Oh God, I need oncology nurses so bad. They could take
Really?
anything. And we need
Okay.
them in the care management, case management, but we also need them in utilization review very badly.
Okay.
Oncology is really needed.
Oncology. Good as well. They're needed.
Yeah, behavioral
I
health,
see
mental health
that.
for RNs.
Yeah.
RNs.
RNs.
Only because a lot of the behavioral health, mental health jobs
Mm-hmm.
for utilization review or case management prefer an RN.
What about
So,
NPs? Do you think that there's a lot of roles for NPs in
oh,
room?
the NPs take our courses all the time.
Yeah.
But a lot of times the NPs take our courses and they don't want to be an NP anymore. They want to go back
Oh.
to being an RN again.
Right.
So yeah, I have a lot of NPs that take our courses. They might have worked as an NP 2 years or 10 years or 15 years. Now they want to learn utilization review, work from home. They're willing to take, from their $110,000 or $120,000 job, they're willing to go down to 90 or 80 just to get away from what they've been dealing with. Now, yes, we do have some people making 100,000, but I always tell them the RNs they're going to make between 80 and usually 90, but we do have some that make 100,000. And I've never seen a nurse that has taken any of my courses make more than 104, and it's rare. I don't want to make people think that, working from home, a lot of people lie and they, tell you just what you want to hear. But LPNs working from home make anywhere from $28 to up to $35.
Okay.
Most of them are $34 and under. I know there are some LPNs that work from home and make 34, 35 an hour, but they've been with the company a long time. Like they worked their way up, 3 or 4 years with United Health. So LPNs, you're not going to make the money that some people lie to you and tell you that you're going to make. I tell you the truth. RNs are going to make anywhere from $38 an hour to about $52 an hour, with 40 to 44 an hour being the average that I'm seeing for RNs working from home in just about any of the courses that I have.
And that's not including the bonuses, huh?
Right.
Bonuses,
And I was going to say,
yeah.
yeah, that like Humana, Cigna, Elevance, like Cigna offers a lot of the RNs and their and LPNs too get anywhere from 5,000 to 9,000 a year in bonus money if their department does well, or it goes to how the company does and how their department does. Like Elevance Health, I have thousands of nurses with them, and they'll give anywhere from $3,000 to $6,000 a year bonus. Maybe a little bit more. CVS lowered their bonuses this year, but CVS has always given yearly bonuses. Now, it's not for everybody. It depends, depends on what area you're in and your department. And it'll say it in the job ad, it might say eligible for annual bonus at the bottom, or in your contract when they hire you, it'll show that you're eligible. So yeah, when I'm saying these amounts of money, I'm not counting the bonuses that some of you get. So I always try to be honest with people. There's lots of people that lie to you and tell you that you're going to, make this massive money. And sure, you make decent money working from home and you save money because you're not, out commuting everywhere and buying, Starbucks and lunch and, everything.
Though I still do from time to time.
I do too once in a while, but but all that money I used to spend, I go in night shift at 7 p.m. and I'd be at the Starbucks, and it's like I spent so much money. And then in the middle of the night, a lot of the nurses would say they were gonna, like, I think it's like 1 a.m. A couple places that were still open till 2 a.m. They were gonna go for a food run down to wherever. And just tell nurses, because I want to be honest, I tell them, about 80% of you are going to take a slight pay cut. 10% of you might take a bigger pay cut, and 10% of you are going to get a pay increase. So, I mean, that's what I see. So I go over the past 6 years of what I've been seeing. Sometimes when you go with the higher range, the computer is set up to bleep you out for the first or second range. Like scan you right out of it with the scanning system. So I know the companies that do that. So yeah, there's certain companies
with the offer letter, or you mean
no,
like when you're applying?
When you're applying, they'll say what is the ratio, or they'll ask you to put in a number. And if you put in something that they've already blocked out, you're out of it. You're gone.
You knock yourself out of the system.
Also, when the first interview happens and you talk with the the gatekeeper that's going to do your first interview, the recruiter, they try to sometimes get you to pinpoint a range or a number. And I've taught my nurses how to handle that, because we do our very best not to answer that question. And then if you have to answer it, there's a certain way to answer it.
Okay.
So,
okay.
yeah. Yeah.
I don't know. When they asked me, I was like, I would like to be at this number, but I'm open to,
Right. Yeah. Yeah.
and so I landed exactly what I
And then,
wanted.
and also when you put in a certain number, if it's not quite, if it's a little lower than what you want, that's okay
Yeah.
because they just want a range. And then when they're talking to you into the interview and they're going over the actual job description, and then they say, is this or this okay? And you can say, well, now that you've explained the job to me, I really think this would be the proper rate. So that's when you can
Okay.
come in and say, now that I
Nice.
understand the whole job description, I would say this.
You
A lot of
see?
nurses get a
So
lot of
many
nurses get
gems, you guys. Pay attention to how
yeah.
many gems are in these courses. Because look, I didn't take it, so I could have eliminated myself. It was nobody but God. So have there been any nursing roles that I didn't mention that you get asked a lot? Like, which one will be best for
Oh, well,
me?
yeah.
Okay.
CDI nurse, clinical
CDI.
documentation. A lot of nurses want to learn CDI, and that
Yeah.
again is one of those programs where you got to work a couple years in the field
Okay.
doing the clinical documentation and doing the tasks to be able to sit for the exam for CDI. So, but there is a CDI apprentice program that you can take, and that'll give you, some information to get into CDI. So a lot of nurses ask me, like, do I teach CDI? And I always said no, but I have a nurse who just, who's one of my teachers who just got a job in CDI, and she's been in utilization review. So we are probably going to come out with a CDI course maybe 6 months down the road. And it won't be, advanced. It'll be kind of like my other courses, giving you a good introductory so that you can get in. Some companies will say that you need a certification in CDI, which is like 2 years to get that. Or others will say CDI in process, or they'll say knowledge of. So there are many opportunities. And then usually with my courses, I can get the employers to hire my nurses. So because if they get a few of my nurses in there, they want more and more and more.
Nice.
So it's
Let
I have
me
some
ask you this,
amazing
because I don't know
people.
why I'm connecting CDI and the HEDIS course. Are those
No,
two
CDI
different?
has
No,
nothing
it's
to do with
totally
HEDIS.
different?
CDI has a lot to do with clinical documentation and coding.
Okay.
And how you get paid, and also quality. And because if you don't have quality documentation that backs up everything with the billing and the proper codes. So a coding person puts in your codes. Utilization review, we talk a little bit about coding because everything's like all set up anyway because it's in all the software. But with a CDI nurse, they have to make sure the coding is right, but also all the documentation will fit Medicare and all the different guidelines, federal guidelines. Because if your nurses are not following, if they're not doing proper notes, all the I's are dotted, the T's are crossed, then you're not going to get paid, or you're going to get fines and penalties because you didn't meet the standards.
So that would be the CDI.
Yeah, CDI.
And what is the HEDIS nurses? Is it similar to what the CDI? You said it's a little bit different.
No.
It's totally different. Okay.
HEDIS is almost like a report card as to population health and preventative health care, and how any patient, rich or poor, any age, is being treated and given the proper health care that everyone deserves, such as breast exam, colonoscopy. The kids are getting, the immunizations that they're supposed to be offered to them. So it's not like, oh, you have to have the like the shingle shot for the adults, the herpes zoster, whatever shot, pneumonia shot. Like, things have to be offered to every person of every walk of life. They can say no to anything, but it has to be offered. So HEDIS is like a report card.
Healthcare effectiveness data and information set.
Okay, thank you. So they're pulling out information from patients' charts to make sure that the measures and guidelines are being met. Part-time or full-time. A lot of HEDIS jobs have now been switched to full-time. That happened about 3 years ago. Full-time remote. There are some that are full-time in the office. We still have some part-time remote jobs, but a lot of the part-time remote nurses were unreliable because they had like regular jobs and they were doing this part-time. So, I mean, there's a lot of amazing ones. I have loads and loads and loads that work for United Healthcare and Elevance and different companies. But a lot of the companies are switching this January through May job or this October through May job to full-time remote. So yes, we still have opportunities for part-time, but I don't want to, make people think that there's loads and loads of part-time jobs. There are quite a few, but there's less than there used to be.
The last question I have for you, is there anything you want to add for anyone who is considering taking your course? And
we're a nice group of people, and we have fun, but it's serious too. I mean, we want you to land a job that's going to change your life. Employers don't discriminate against remote nurses. Some people in there, like I'm 63, and some people like 50 or 60, and they're like, oh, well, I'm older, and I feel like I'm getting discriminated against. I'm like, you're young, and I'm like, well, you might have a little discrimination in the hospital and at the bedside, but remotely, employers value a nurse that's been a nurse for a long time. They value the 60 and 65 and 70-year-olds. They have so much more to offer. Not that they don't value a 20 or 30-year-old, but
knowledge. Yeah.
So
I value
I
them.
just say, look, we have nurses that are burnt out. We have nurses that are injured. We have some nurses that want to make the change because it's just going to be better for their lifestyle and their family. So there's all kinds of reasons why, and it's not all just disgruntled nurses who are just burnt out. Some of them don't want to leave the bedside, but they have to for various reasons.
Family, that was one.
And I just wanted to mention that there's a lot of young ones getting hurt. And why do we get hurt? Because we don't have enough help. The hospitals, the nursing homes, everywhere. There's not enough help.
Even if you're undecided and you're not sure if this course or the courses are right for you, go ahead and maybe join the group just so you can see how many other nurses are in these fields and how it's working for them, and learn more about the different.
And yes, we do have a group with 64,000 nurses. I check every person that comes in and vet them. They have to answer some questions, so make sure you answer the questions. It's on Facebook. She'll put all the information out there for you. So I wanted to give, besides talking to Nurse D, because she can definitely help you and guide you. Also, if you want more information on the course, Jessica can be contacted. Office of Jessica at gmail.com. And
I'll put it here.
And she'll put it in. Yeah. So office of Jessica at gmail.com. That's Jessica Christopher. She's an RN. She was my charge nurse when I worked in the hospital. Gosh, I've been out of there like, I don't know, 5 years now, or maybe. But anyway, Jessica was my charge nurse, and I eventually, she's an RN. I eventually took her with me, and now I'm her boss. But anyway, that was kind of fun because she works for me. And so we've got Jessica Christopher. Also on Instagram, I'm Remote Nurse Marie. So on Instagram, Remote Nurse Marie. I have a Facebook page called Remote Nurse Marie also. So Insta Remote Nurse Marie, Facebook Remote Nurse Marie is the page. Then I have a group on Facebook that she'll be Nurse D will put up. I have a website called The Work at Home Nurse, theworkathome.nurse.com. That's one of my websites. And let me see, I wrote a bunch of notes here. Yeah, where's my LinkedIn? Oh yeah, LinkedIn, Insta. Oh, LinkedIn, I'm called Remote Nurse Jobs. So I'm called Marie Peppers, or if you put just in the LinkedIn section, Remote Nurse Jobs will come up. So Marie Peppers on LinkedIn. And I am connected to many, like thousands of employers and recruiters and thousands of nurses on there. So that's it.
Okay, so and guys, the one last question that I was asked specifically from a friend of mine is how to purchase the course. And so I will put links to the courses that we've mentioned here today where you can click on. It's in the description, guys. So click on the link and it'll take you into the course section where you can learn about the course, see the price, and all of those things. If you are still unsure kind of where you want to go, reach out to Jessica Christopher, or you can reach out to myself. I'll also put that description in the description of this video as well. So thank you so much for watching. If you guys still have more questions, go ahead and ask them in the comment section. Make sure you like and subscribe, and I promise you guys, I'll keep these coming. Bye.
Thank you. Bye.